Hello, friends. Welcome back to Energy in Health. Today we'll talk about a topic that worries many people, headaches and the fear of stroke. A lot of people think, if I have a headache, it means I'm having a stroke. But let's calm down for a second. Headache doesn't always mean something terrible. In most cases, it's simply your body's reaction to stress, fatigue, poor sleep, or muscle tension. So today, I'll explain how to tell the difference between a dangerous headache and a benign, harmless headache that just means you need to rest and recharge. First, what is a stroke and why does it hurt? A stroke happens when blood flow to part of the brain is interrupted, either because a vessel is blocked by a clot or ruptures and bleeds. At that moment, brain cells stop getting oxygen and begin to die. Sometimes that process causes a sudden, sharp pain, a pain like an explosion inside your head. But here's the key. Not every stroke comes with pain, and not every pain means stroke. Statistically, only about 10 to 15% of strokes begin with a strong headache. So here are the 3 red flag signs you should never ignore.
Sign number 1, a first-time severe headache in later life. If you are over 45 or 50 and you've never had headaches before, but suddenly, out of nowhere, you feel a sharp, unusual, intense pain, take it seriously. Most common headaches, like migraines, start earlier in your 20s or 30s, and you usually know their pattern, where they hurt, how long they last, what helps. But if this pain feels completely new, and especially if it comes suddenly and strongly, it could be a sign of a vascular problem, a mini stroke, or a circulation issue in the brain. That's when you need to check your blood pressure and get a brain scan as soon as possible.
Sign number 2, headache with confusion or fainting. If the pain comes together with dizziness, blurred vision, disorientation, slurred speech, or loss of consciousness, don't wait. That's a serious emergency. In that situation, call an ambulance immediately. Don't try to sleep it off or take painkillers. Every minute counts. The brain starts suffering from lack of oxygen within just 5 minutes. And note this, in women and elderly people, a stroke can sometimes start without pain, just with confusion, weakness, or a foggy mind. So never ignore sudden mental changes. Sign number 3, dagger-like headache. Patients often describe it as a blow inside my head or an explosion I've never felt before. It appears instantly, in 1 second, and is often followed by nausea, vomiting, or weakness. This can mean a ruptured aneurysm, a small bulge in a blood vessel that bursts and causes bleeding inside the brain. It's an extremely dangerous condition and needs immediate hospitalization. Even if the pain eases after a few minutes, don't risk it. Call emergency services right away. Other symptoms that should make you alert: pain getting worse day by day, numbness in the arm, face, or tongue, slurred speech, double or blurry vision, trouble walking or keeping balance. If you notice any of these together with headache, treat it as an emergency. Now, let's talk about the 90% of headaches that are not dangerous. Most people experience these types. Number 1, migraine, throbbing pain, usually on one side, often with nausea and sensitivity to light or noise. It's more common in women and often linked to hormones. Number 2, tension headache, dull, squeezing pain, like a tight band around your head. It often appears in the evening after stress or computer work. Number 3, cervicogenic or neck-related headache. It comes from neck tension or spine problems. You may feel it in the back of the head or temples. Number 4,
hypertensive headache, caused by high blood pressure, often pulsing at the back of the head or temples.
What helps with these everyday headaches? Measure your blood pressure regularly. Sleep at least 7 hours a night. Take breaks from screens. Drink enough water, at least 1.5 liters daily. Limit salt, caffeine, and sugar. Stretch your neck and shoulders every few hours. Try deep breathing or light walking outdoors. Even 5 minutes of stretching can relax your muscles and improve blood flow to the brain.
Remember this, your body is not your enemy, it's your ally. Pain is a message. It's your body's way of saying, something is off, please take care of me. When you learn to listen to that language, you can prevent serious diseases and keep your brain strong and clear for years.
Let's summarize. A dangerous headache is sudden, new, or dagger-like, comes with confusion or loss of consciousness, or appears for the first time after age 50. A benign headache is familiar, repeated, linked to stress or fatigue, and goes away with rest, hydration, or relaxation. Take care of yourself, friends. Check your pressure, rest when you need to, and let your headache only from inspiration, not pain. This was Energy and Health. Please like, subscribe, and share this video with your loved ones, because sometimes knowledge can truly save a life. Stay healthy, aware, and full of energy.